The aortic valve is the valve that lets the blood out of the heart. When your left ventricle squeezes, it ejects the blood through the aortic valve to the aorta, which is the main pipe that delivers blood to the entire body. The most common problem we see is aortic valve stenosis, which means that the valve is not opening properly. It's offering resistance to flow. So the heart has to pump harder in order to get the blood out. Aortic stenosis can manifest itself with symptoms such as chest pain, shortness of breath, or lightheadedness, or even passing out when you stand up. If you have any of those symptoms, it usually means it's a severe degree of aortic valve stenosis and probably requires treatment, such as replacement of the aortic valve. We're talking about two options. One is traditional surgery, which I like to do through a small incision or a minimally invasive approach. And the other one is transcatheter aortic valve replacement, which is done without opening the chest, usually through a catheter through the femoral artery in the groin. So the difference between surgical aortic valve replacement and transcatheter valve replacement is for a traditional surgery, even done through a small incision, we use a heart-lung machine. We stop the heart and open it up and cut out the diseased valve and sew in a replacement valve. That could be the right choice for patients if they're younger and have less comorbidity, because that is a tried and true operation which will probably last for up to 20 years. Transcatheter aortic valve replacement can be done without opening the chest, and the valve is delivered on a catheter and essentially pushes the diseased valve aside and lodges within it. It's very effective for people who have lots of comorbidity or other problems because it's less stressful on the body. The things we don't know about transcatheter aortic valve is how long will it last. It also comes with a slightly increased risk of permanent pacemaker implantation. When patients have their valve replaced, we hope their symptoms get better, and they often notice that immediately. That usually leads to an improved quality of life. One of the advantages we have at Grand Strand Health is that we can fix valves from a variety of approaches. We can use either traditional surgery or minimally invasive techniques or transcatheter techniques to repair or replace a valve. I think it's important for patients to have all those options in front of them, and when our team evaluates them, we consider all the choices before making a recommendation.